Philip Kemp has a thriving dental practice in one of the most affluent counties in America. But for Dr. Kemp, it wasn't enough. He wanted to give himself away.
I've always had a desire to mentor and teach young dentists and give back. And I just feel like God has specifically given me the passions and the desire to teach. And this whole process has really been a culmination of that dream to mentor and help people out in situations of their life that they're in, specifically in the practice of dentistry.
Well, what it means for all of us to be able to be here, come to Dr. Kemp's office, and be able to work out of here is just a wonderful way for us to be able to get the clinical experience of working out of a private practice instead of working in a school setting. Be able to work with men who have been, and ladies who've been out in private practice and know how things run here. It's just a great way for us to learn, and it's a great way for us to be able to give back to the community, give back to people who are in need.
We are trying to put students in situations where they're challenged, where they're taught, where they're mentored, and more than anything, they're just you just wrap your arms around them, you lock arms, and you walk through life together.
Philip's ministry is beyond what I can even describe for these women. The women that I work with at the Hope Center are women who have come out of primarily addictions to all kinds of drug addictions, alcohol addictions, street life. And many of them, their teeth, through all those years of abuse, are just completely destroyed, broken off, just horrible decay. And so they cannot really, even though they've worked so hard to recover, and that their life is absolutely changed upside down. They go from street life to completely recovered and restored and ready to enter into real life, productive citizens again. But because their teeth are so bad, nobody wants to hire them for any kind of public position or public job.
This opportunity to get this dental work is a blessing to me because, for one, I have low self-esteem. And not only will it help me with my self-esteem, it'll help me in raising my daughter to have self-esteem regardless of what she looks like. And me getting this is just a blessing to me. The words can't explain how I feel about it.
So it's an opportunity for us because we're able to take these patients and we're able to give students patients that really are more advanced and more difficult than what they see in the school setting. But it also gives them an opportunity to see people who are struggling, who are really trying to get their life turned around, and from a standpoint of what they get, not only just from the practical teaching, but more than anything, real life setting. It's powerful. You know, from the standpoint of ministry, I mean, I try to look at my life as a ministry, you know, and God has put me in a situation where I'm practicing dentistry, and that's my ministry. You know, my ultimate ministry is my family. My relationship with my kids, my relationship with my wife. My second is my practice. So in that situation, I feel like God has called me to the mission field, which is here in Brentwood, in this office, with the people I work with and the people that are coming my way, whether it's from UT, whether it's from a course that we put on, or whether it's just relationships that I make. So this ministry is when I'm challenging myself and challenging everybody involved. The ministry of what we do is building relationships. The spiritual emphasis for myself, or the spiritual catalyst, is to give my life away. I mean, ultimately is to look for an opportunity not to build success, but to build significance.